So now we're going to be talking about the different types of movements that synovial joints are capable of. We're going to have four basic groups. We have gliding motions, right, where these two bones are going to slide against each other. We have angular motion, rotational motion, and special movements. So gliding motion, you'll usually get these between flat bones, and they're just going to slide back and forth or side to side. Common between the carpals and tarsals, the bones in our ankles and the bones in our wrist. Now, angular motion is probably one of the most used classifications. We're going to spend a good deal of time talking about this. So the basic types are flexion, extension, hyperextension, lateral flexion, abduction, abduction, adduction, adduction, and circumduction. So what I have written over here on the right-hand side are a little bit of a cheat sheet. They are not explicitly correct, but it gives you some idea of what I'm talking about. So this is sort of a Cliff's note, but don't take this as the complete truth. So the definition of flexion is a movement between two bones such that the angle between them decreases. The angle between them decreases. So an example, right, this is 180 degrees between my humerus and my radius and ulna. So that's 180 degrees. Start, stop, that angle has decreased to 90 degrees. So that would be an example of flexion. Start, stop, flexion here at the elbow. I've decreased from 180 degrees down to 90 degrees. The opposite of that, start, stop, to increase the angle would be an example of extension. So start, stop, flexion, start, stop, extension. Now, if I could bend my elbow more than 180 degrees, like bend it like that, like if I was a Balinese dancer or something like that, that would be an example of hyperextension, going beyond, extending beyond 180 degrees. I am not double jointed. I can't do that. So all I can do is 180 degrees. All right, next one, lateral flexion. Lateral flexion is special. It just refers to leaning over one side, bending of your vertebral column. Abduction, abduction means motion away from the midline of the body. So a good example, now we're referencing the glenohumeral joint. If I'm going to abduct my arm, right, like that. So I'm moving away from the midline of my body. Start, stop, that is abduction, abduction. The opposite of that, start, stop, this is adduction, adduction. I'm moving my hand closer to the midline of my body. So abduction, adduction. Circumduction just means you're moving in a circle. Okay, so the example given here, on the left-hand side, we see an individual's head capable of flexion, extension, and hyperextension. So going from here to here, that would be flexion, because I'm decreasing from 180 degrees down to like almost 90, right? Start, stop, I'm increasing that angle back to 180 degrees, that is extension. Start, stop, going beyond 180 degrees, hyperextension. Hopefully that's kind of clear, right? Over here with the arm, I've already given you an example of that. You can also extend and flex your hand. So here, right, to keep it consistent with the picture of the book, right, this is your 180 degrees, right? We don't do this very often, but we do a whole lot of that. So start, stop, flexion, start, stop, extension, start, stop, hyperextension, right? I'm hyperextending. I'm going beyond 180 degrees here. Now, pay particular attention here. So when we move the knee, the direction is different. How we're judging their angle. So let's pretend this is my knee, right? Let's pretend this is my knee. Let's get this out of the frame to make it easier. Pretend this is my knee. Knees bend like this, correct? Right, knees don't bend like that. If this is my patella and my leg is doing that, that's a bad day for me, right? Knees don't bend this direction, knees bend that direction. So in this case, the angle is over here. This would be 180 degrees. So moving my leg this way, so this would be my foot, this would be decreasing that angle. So that would be flexion, right? That's different with my arm. This way is flexion. But with my knee, that way is flexion. What you consider, right? If you were, so another way of thinking of it, think of this as a protractor, right? In your elbow, since your elbows bend in this plane, in this direction, they bend forward, the protractor goes in this direction, right? So when you can't bend your elbows backwards, your elbows don't work that way unless it's a really bad day. This is 180 degrees, you're making it smaller. And with the picture here on the right-hand side, when you make the angle between the femur and the tibia and fibula smaller, that's flexion. When you make that angle 180 degrees, or you go from, in this case, 90 degrees to 180 degrees, that is extension. It's just moving in a different direction. But the important understanding here is, are you increasing the angle? Then it's extension. If you're decreasing the angle, it's flexion. It all has to do with the bones. And frankly, the reason we're learning this terminology, it's really not that useful for articulations, but you need to know it. What this is really important for is understanding the function of muscles, because what muscles do, muscles get short. When muscles get short, they pull on bones, and then the bones are going to change their angle relative to each other. So the reason we're really learning this is not for the characterization of articulations, it's for understanding what muscles are going to do. So we do need to understand this concept. I will work through some examples when we have our Zoom session. So just remember, flexion means you're going to decrease the angle between the two bones, and extension means you're going to increase. If you go beyond 180 degrees, like a straight limb, if you go beyond that, that is considered hyperextension. Right, lateral flexion, right? The vertebral column is just bending over, right? All those symphyses in between each vertebra that is amphiarthritic, a lot of small little motions all added up can lead to a big motion. Abduction, abduction, moving away from the body line. The opposite of that, the hand moving towards the midline of the body, is adduction. If you get confused between abduction and adduction, I think bringing your arms closer to the center of your body makes the center of your body bigger, and that's adding. You're adding to the center of your body. Adduction. If that works for you, great. If not, don't worry about it. You can adduct and abduct your arm. You can abduct and adduct your leg. You can also abduct and adduct your hand. You can abduct and adduct your hand. So, your fingers. When you abduct and adduct your hand, you're moving the hand closer to the center line of your body. When you abduct your fingers or adduct your fingers, you move closer to the center line of the hand. So just to make that clear. Circumduction, that's just a rotational motion in 3 dimensions. Okay, so that was angular motion. Now we need to talk about rotational motion. So we have lateral rotation, medial rotation, pronation, and supination. So just regular rotation, that was like our C1, C2 joint. The book example gives here is start, stop. Start, stop. This is a medial rotation. What bone is rotating? Think about that. Start, stop. That's a lateral rotation because my arm is moving away from the center line of my body. That's a lateral rotation. You can do the same thing with your lower limbs as well. Now, the last one, pronation versus supination. Pronation versus supination. How do you keep these clear? It's a stupid little thing, but what I always remember, right? If you're talking to somebody, you go, what's up? What's up? Right? Sup for supination. This is pronation. That is supination. The rotation, start, stop, supination. Start, stop, pronation. Again, if it works for you, then go for it. Special movements. Only certain bones are going to be doing this. Depression and elevation. Your scapular elevation, perhaps the sound of my voice causes scapular elevation. You just need to take a minute, relax, breathe, and depress your scapula. Dorsiflexion, plantar flexion. These are special movements of the foot. I'll explain when we see the picture. Inversion and eversion, also special movements of the foot. Protraction and retraction. If I were to protract my scapula, I might appear to be a little bit lacking in confidence. However, if I retract my scapula, I might look more presentable, if that's possible. Opposition is an easy one. Opposable thumb, right there is opposition. Okay, so here's our example. Depression, scapula move inferiorly, elevation, the scapula elevate. Dorsiflexion, right? Bringing the dorsum of your foot superiorly. Plantar flexion, moving the plantar region of your foot inferiorly. So if this is your leg and this is your foot, that's dorsiflexion, that's plantar flexion. Inversion and eversion, these are also special movements of the foot. If these are your feet, right, these are your big toes. If you stand on the edge of your foot, that is inversion. If you stand on the medial line, the medial edge of your foot, standing on your big toes, that would be eversion. I can't even do that, but I can invert my foot, but I can't really evert my foot. I don't know. In this lovely example between protraction and retraction, right? If you protract your mandible or retract your mandible, you look really smart, right? Or retract. Scapula can protract and retract. Mandible can protract and retract. Right. So here we have a nice little synopsis of all the different types of movements for the different synovial articulations. So definitely want to familiarize yourself with all of these.